It's absolutely vital to do a hospital tour for so many reasons. I'll start with the most important one, and that is that you know how to get to the hospital. Secondly, that you feel comfortable in the environment and you get to know perhaps some of the staff. So on your tour, you could ask to speak to the labour ward sister, perhaps ask them to show you the neonatal unit, and definitely ask them what their policy is on breastfeeding and babies rooming in. We really would hope that the hospital that you choose is one that is mom and baby friendly. So that would mean that they encourage the babies to room in, that they support you with skin to skin, which is really keeping your baby close on your chest, and that they are able to assist you with breastfeeding or whatever choice you've made to feed your baby. They're able to give you advice on that. It is important that a lactation specialist is on the unit, and that way you'll be able to get the right advice from the beginning without lots of conflicting advice from different people. You would also need to be sure that you're pre-admitted. So on the day that you go into labour, you don't have to stop at reception and fill in lots of forms. If you've filled in a pre-admission form beforehand, you should be able to go straight up to the labour ward when the time comes. A hospital tour is a chance for you to ask all the important questions, such as, if for some reason I go into premature labour, what is the policy? Where do we go? What kind of specialists do you have? How would you deal with it? And you're asking these questions so that you can be sure at the time you will get the best care. Most hospitals have excellent ICU units, but you need to ask them, if my baby's admitted to the intensive care unit or the high care unit, what is your policy on visitors? Is my partner allowed in? If I'm in theatre having a cesarean section, would you allow my partner to come in and be with the baby at any point? You also need to ask the hospital, how long are you allowed to stay? And if you need to extend that by an extra day, would that be okay? And what are the costs involved? There's often a great deal of cost involved in getting a private room. I would encourage all moms to try their best to have a private room so that your partner can stay over that first night and help you wherever possible. You're also doing a hospital visit to have a look at the labour ward. And in the labour ward, you're having a look to see, do they have a bath and am I allowed to use water for pain relief? Do they allow water births and are they qualified to do water births? Many hospitals may have a bath, but only for you to get in to relieve your pain during contractions and not to deliver your baby. So you need to be sure of that. So if you're planning a water birth, it's not good to choose a hospital without a bath or that's not specialized or qualified or experienced in doing water births. You need to check in the labour ward what type of positions are you allowed to be in during your labour, because for a natural birth, it's ideal not to be flat on your back on the bed. Do they have a bed where you can take the bottom half off and perhaps sit up? And so when it comes to the pushing phase, you can get into a position that's much more easier for you to work with your body. Do they have a U-shaped squatting chair? These are fantastic. Some labour wards have them, some don't, and that will enable you to use the position squatting to deliver your baby, which helps open the pelvis more and can be a wonderful position to deliver in. Does the hospital allow you to walk around during labour? Because an active labour can help take 1 hour off your birth, which is a lot of time. So if you're allowed to mobilise and be free, that's fantastic. Ask the hospital, do they allow walking epidurals? Walking epidural is where you are given medication to numb you or anaesthetize you from really here, the upper waist down. But with a walking epidural, you're able to move around and help the baby's head to come down beautifully and put pressure on the cervix to help it dilate. So what is the hospital's policy on epidurals? Are you allowed to request them? Are you given them routinely? Can you get your own anaesthetist, or must it be an anaesthetist they've chosen for you? I realise this is a lot of questions to ask, but when you're drawing up your birth plan, it is really no good having a birth plan and you arrive at the hospital and they say, we don't allow squatting, we're not going to allow you to have an active birth, or we prefer you on the bed to be monitored continuously. For good births to happen, the following needs to be in place. You should be allowed to move freely. Your baby should be allowed to room in with you. For breastfeeding to take place, there should ideally be a breastfeeding policy on the unit. Ask to see that policy. Are they encouraging moms to feed as little and often as possible? When I say little, I mean often as possible, little bits at a time, as opposed to an hour on the breast every 5 hours, because we know that babies, especially newborns, like to feed little and often. The average newborn would feed 8 to 12 times in 24 hours. When you're drawing up your birth plan, it doesn't make any use if you've written on your birth plan, I'd like a walking epidural, but the hospital doesn't allow it or doesn't have an anaesthetist who can do that for you. So you really want your birth plan or your birth wishes to be in line with what the hospital is offering, which is one of the reasons that you do a hospital visit or a hospital tour, so that you can check everything on your list is encouraged in that hospital. If for some reason you need to come into the hospital early and things aren't going to plan, and you need to have perhaps a cesarean section, ask the hospital what is their policy on allowing partners into the theatre. Believe it or not, in today's day and age, there are still hospitals that will ask the father to stay outside. There are still hospitals that won't allow you to bring a doula in. It is your right to have the support people who you have chosen and whom you trust to be with you. We know that better births take place when you have those people close. So make sure you can bring your partner in, and if you have a qualified doula whom the doctor has met or trusts or would actually be happy for you to use, definitely take a doula with you and check that the hospital allows that.